like I said, this is a 1944 doctor and mortician, which sounds like a conflict of interest to me. But anyway, I want to point out a couple of features in here, one being the machine over here by the door. And that machine sucks the fluids out of your body when you die, or it can be used in like in tonsillectomy. Remember, you have about 16 pints of blood in your body, and when you get your tonsils out, you lose about 3 pints. Today, they cauterize, and you lose about a half a teaspoon. And I'll show you some tools here in a minute. So anyway, we've got a couple of diplomas in here, and we have some skeletal parts and cabinets full of all of the things you would need for embalming and stuff, and for treatment. There's some embalming bottles back over here. So, okay, well, let's move over and talk about the tools just a little bit. Oh, excuse me. This is a dictaphone. So today, my doctor, for instance, uses a little recorder, and after he's done his diagnosis or whatever, and then he talks into a thing. Well, the doctors back then did as well, and talked in, and they cut a round wax cylinder tape record developed by Thomas Edison, to tell the patient's symptoms and the recommendations for treatment. Okay. The posters behind me here, over here, show the patient, where the problems lie, and it might be because of the nerves or whatever over here, or surgery for the tonsils back there, etc., like that. And they would have had those in the office to show the patients. We have a partial skeleton over here that came from Oregon, and it was in a doctor's office here and therapist's office here. And I went in for therapy, and he says, you know, I got a skeleton in the closet. And I said, don't we all? And he gave the skull away for somebody when they asked for it, and he gave the feet away to some podiatrist or something like that. So that's all we got left. We got one leg, but it looks funny with one leg. The table here is from the Telluride Historical Society, and it was in the, the museum in Telluride is in the old hospital. And so this chair, for example, that table, this table, exam table, are all on loan by the Telluride Museum. So, all right, let's move on over here to talk about tools. Well, has anybody here had their tonsils out? Oh, you have? You have. Okay, well, you want to know how it's done? Well, you're going to learn anyway. So, ether was commonly used to put you out and into the 1970s, that late. And what they would do, they would have gauze. They would have gauze in here saturated with ether, and they'd put this on your nose until you fell asleep. And anybody that's ever had ether, anybody that was old enough to remember, would never forget that smell of ether. It is sweet, sicky smell that stays with you the rest of your life. Then they would put this in your mouth to hold your tongue out of the way. And I had a lady in here a while back, and she said, my mouth isn't that big. And her husband was standing right behind her. You know what he said? Yes, it is. And she turned around and slapped him. And it was one of those ringing slaps that really projects. Anyway, they argued a little bit and left. So I got to be careful what I say here. But anyway, you'd stretch your mouth to get to your tonsils. Then they would use this tool right here, sort of like a toothpick into an olive. And they would stab the tonsils to hold them, and then slice them off. And you lose about 3 pints of blood. And that's why you have this other machine that we talked about. But anyway, today it's similar, but they very seldom take out tonsils, right? But anyway, when they do, it has a stem on it, electric stem on it to cauterize, so you only lose about three teaspoons of blood. Okay? I don't know what many of these tools are, so I'm not even going to try. So we'll move on, I think. We're about ready to go outside. And if you have any questions, catch me as we go. All right?